Every year in the UK, a third of people over the age of 65 fall at least once, which means that in this year alone, at least 4 million people will experience a fall. Aside from physical injuries, the mental and emotional consequences of a fall are serious. A survey commissioned by Age UK found that millions of older people are worried about falling over, with 4.3 million saying it topped their list of concerns. My name is Ernie, and in this video we're going to explain what causes falls in the elderly and some tips and tricks you can implement to reduce the risk. What causes old adults to fall? At a very simple level, falls occur because of a loss of balance. The processes that enable a toddler to stand and walk are the first to break down in the elderly, which increases their risk of losing balance and falling. At a recent Fail Gains webinar, Dr. David Shipway covered this in more detail. Here he is.
So what is it that can go wrong to cause falls? Well, broadly speaking, anything that affects any part or constituent, any of the moving parts, if you will, in this process. So there's lots that can go wrong here. And of course, as we see in older people, a lot of people suffer from medical illnesses that compromises these systems. And of course, although I've discussed now the physiology of falling and trying to retain your balance, broadly speaking, these are the similar processes that are going to be needed to get up off the floor. So if you're bad enough to go down in the first place, then getting up is often a problem as well.
Many health conditions and symptoms can increase the likelihood of falling. A combination of two or more of these factors increases the risk even more. Conditions and health factors that can cause falls include diabetes, osteoporosis, a previous history of vertigo, health conditions that cause muscle rigidity and weakness, such as Parkinson's disease, difficulty seeing or hearing, cognitive impairment and dementia, or conditions that cause rush movement to bathrooms, such as incontinence. Statistics show that 50 to 60% of all falls happen at home. This is mainly because, compared to the professional environment such as a care home, private homes are normally not designed to be easily accessible for the elderly. Environmental factors that can contribute to falls include upturned carpet and loose rugs, poor lighting, especially on the stairs, cluttered environments, slippery floors, lack of grab rails and bars, difficult access to bathrooms or bedrooms, and a change in floor levels. In addition to the health and environmental factors, there is also a proven link between certain medications and an increased risk of falling among the elderly. Some of the medications that are known to negatively affect balance and coordination include psychotropic drugs such as sedatives, antipsychotics and antidepressants, antihistamines, cardiovascular medications such as beta blockers or diuretics, and anti-anxiety drugs such as diazepam and lorazepam. Because most falls happen at home, creating a safe home environment can be one of the most effective ways to prevent falls. Areas to focus on include improving lighting in dimly lit parts of the house, fixing upturned carpet and securing rugs and mats, carpeting slippery floors, removing obvious tripping hazards, fitting grab rails, especially in bathrooms or stairways, and fitting non-skid mats in bathrooms. As you can see, there are lots of tactics you can employ to help prevent a fall in your home. You can also check out our list of 5 simple home modifications that can help prevent a fall. In the World Guidelines for Falls Prevention and Management for Older Adults, both the American and British Geriatric Society have pointed out that unsuitable footwear is a significant cause of loss of balance. Loose, worn or backless slippers are not safe for the elderly, and shoes with poor grip or worn soles can cause you to slip easily, especially on a wet surface. Your shoes should be snug, grippy and have a firm fastener. Your risk of falling can be decreased through exercise. It has been demonstrated that exercises or training that improve gait, strength and balance reduce the chance of falling and the likelihood of picking up injuries from falls. If you trip and fall once, it's common to become afraid to move around for fear of falling. This actually decreases your mobility and raises the chance of subsequent falls. Instead, concentrate on preserving your mobility and strength so that you can navigate your home safely. So, we have now explained what causes falls in the elderly and some tips and tricks you can implement to reduce this risk. We trust this has been helpful for you and answered your questions. But if there's anything else we can help answer, please feel free to get in touch.